afternoon. Thank you. Oh, Health and Human Service will come to order. Good afternoon again. All right, Madam Clerk.
Commissioner Baker McCormick,
Here.
Commissioner Marecki, Commissioner Anderson,
Here.
Commissioner Colleen,
Here.
Chair Scott,
Present.
you have a quorum present.
Thank you. Next item, please.
B, Chairwoman's remarks.
I have none. Thank you.
C, approve the June 24th, 2025 meeting minutes.
So moved. Moved
Support.
by Commissioner McCormick, Baker, and second by Tim Colleen,
Yeah.
Commissioner.
That's me.
All right.
Aye.
All in favor?
Aye.
Aye.
Ooh, I got a job.
Okay.
Cool.
Motion carried. Next item, please.
D, unfinished business. There is none listed.
Next item, please.
Moving to item 1 under new business, requesting commission approval of Amendment 3 to a 4-year memorandum of understanding with the Wayne County Prosecutor's Office to continue the Right Track Diversion Program at the 3rd Judicial Circuit Court of Michigan, Juvenile Division for fiscal year 2026.
Thank you. And we have one from each office here.
Good afternoon, Madam Chair.
Yes, good
Tony
afternoon.
Guerrero, Chief of Legislation, Grants, and anything else I can think of for the Prosecutor's Office.
Thank you.
Good afternoon, Melissa Fernandez, Director of Juvenile and Youth Services.
Thank you.
This is the department's request for approval to extend our MOU with the Wayne County Prosecutors for our Right Track program, which is our program to divert young people from the formal system.
The amount is $475,236. The Right Track program has given proven responses, and it is a tremendous savings to the county not having to put these juveniles through the full juvenile justice system. The diversion program is very selective. They have to qualify and make sure that they are on the right track, because the right track says, or rather means, taking responsibility and accepting consequences. We would hope that this body would vote in favor of moving this to the full commission for approval.
And
Thank
We'll
you so
answer any
much.
questions you may have.
All right.
If I can add, in 2024, 270 young people went through this program with a 93 success rate, which means they did not formally enter the system.
All right, wonderful. Commissioner Anderson.
So that is a report on the success of I mean, you really, sounds like you've kept the records of what's been happening with those young people. And that was recidivism is what I just made a note of a few minutes ago, and whether it's working or not. And it sounds like it's working.
Ms.
Thank you.
Fernandez is quite meticulous,
Yeah.
Commissioner.
I understand she's got the arm twisting down pretty good. Just kidding. But thank you.
Thank you. Anyone else? Commissioner McCormick.
Thank you, Madam Chair.
Mhm.
Of the 270,
70.
do we know if any of them come back at all, or if there's any other issues? Do you keep track of them?
We do. So actually that 93% is the percentage of young people who actually complete the program and do not have their case formally pushed forward. But we do have the data that also looks at how many kids went through the program and actually eventually came back. And we'd be happy to share that. It should be listed in our annual report. There is a section devoted to Right Track, so I can follow up with that.
Okay, thank you.
Thank you. Commissioner Colleen.
Yeah, thank you, Madam Chair. And I'm supportive of these efforts to keep kids out of the system. Did it begin in 2019? I went back to look at how long contracts have been going for this. Was 2019 the year that this started?
I believe it was.
Okay, so, right. And it's the 3rd Circuit. Who makes the call on whether a kid can get into this program?
That's the prosecutor's office.
Basically, our office.
That's your office.
Yes, Robert Heimbuch is our Chief of Juvenile, and He's the one who makes the final decision.
Okay. And then what's when I say that, the county prosecutor here, county here, what's the county's involvement in this?
So we contract with the contractors for First Contact and oversee the progress and the statistics and the follow-through of the program.
Yeah, it's, I haven't looked at the annual report in a little bit. I got it sitting in the office, but could you just excerpt that one section? Cause that's what I wanted to see. And do you have it over time
Yes,
rather than 1 year?
yes,
Okay, that would be
sure.
interesting to see, but I think all committee members after
Mhm.
this discussion would just like to see that summary,
Absolutely.
Yeah,
Yeah.
that would be great.
and I'm in favor. Thank you, Madam Chair.
Thank you. Mariki? No? All right. Okay, well, thank you so much. And I need a motion. So moved by Anderson. Support by 2 or 3, huh?
Mariki.
So that's
She got me.
Mariki.
Seemed like a tie.
Thank you. All in favor?
Aye.
All right. Thank you so much. Thank you for the
Thank you very
report.
much.
Thank you for this program. Yes, it's wonderful. Next item.
Moving to the addenda, item 2, requesting commission approval of Amendment 1 to the fiscal year 2025 project allocations for emerging threats, local health department grant agreement with the Michigan Department of Health and Human Services.
Good afternoon, Dr. Sheth, Chief Medical Officer, Wayne County HHVS. This is before you to approve additional funding given to us by MDHHS in our, it's related to our CPBC agreement, but it's our under our emerging threats bundle where a lot of our COVID funding was bundled together and provided to us. And this is a one-time additional funding of that $74,480 to address urgent needs, emergent needs in terms of public health needs, infectious disease, emerging threat needs, and just to offset some of the additional costs we may have right now during this time where there's measles and respiratory viruses that are coming around the corner.
Do we have a large variety of measles?
So Wayne County, so far in 2025, we haven't had any cases in Wayne County, but in Michigan, there continues to be additional cases. There's been some small localized outbreaks in certain regions that have been pretty much contained in Michigan. We're not seeing nearly as much as an impact as we're seeing in other parts of the country right now, primarily in West Texas and Southwest US. But we are closely monitoring it. As we know, this is travel season, summer travel season, and families are traveling to all parts and across the globe. And so there's measles continues to rise across the world with global outbreaks and local outbreaks.
Okay, thank you. Commissioner Anderson?
Thank you. Thank you, Madam Chair. Just wanted to ask you, I'm sure you're probably watching it and certainly aware of the changes coming out of DC and the new Health and Human Services Director, I guess that's his title. And it seems to be reducing the number of people that would be getting many vaccinations, which is, I think, be hard to dispute that the measles cases exploding is not because of this. And then also, of course, we're going to be coming into possibly another COVID outbreak. And have you formulated any opinion or response or how quickly we'll be able to respond to those things happening? Because I don't think the measles outbreaks is that strong here, but certainly in Texas and other states to the south, it seems like it's a bigger problem.
Yeah, so what I would say is that we are closely monitoring what's happening. We our vaccination rates have declined, much like the trend we see in the state of Michigan and across the country. They've been steadily declining, especially during the 2020 post-pandemic years. We are not nearly as low as some of our other regions, even in Michigan. So, for example, around 90% of our kindergartners, school-age children are meeting the current requirements for the regular vaccines they should have for entering schools. We know for measles, for example, we need that number to be more closer to 95% to prevent an outbreak. Not satisfied with those numbers, but definitely not seeing as significant of a decline or as low vaccination rates as we're seeing in other parts. And that's why we're a little bit more protected in this out Wayne County region. What we really worry about is if there's a case that's introduced, a single case in a community or a cohort that has lower vaccination rates. And so that's what we've seen in a lot of areas like ours across the country, where there could be a single case that is introduced in these communities that tend to be together in terms of lower vaccination rates. And obviously the most worrisome case is if it enters a school, right? And so we are, and part of this funding is to support some of those planning efforts, those preparedness efforts. And so we have been ready. And, we've had a few cases over the last year as well, too, that we've had to activate and respond to and mitigate and control, which we did. And so we are, our department is ready to respond if and when there's a case. It is unfortunate that, that the messaging at the national level is what it is. And so what we are really focused on is our local community and making sure we continue to provide and promote evidence-based, science-based information and make that accessible to our community. And so that's what our prime focus is on and continues to be.
That's great.
I appreciate all the efforts, and I just wonder too, are we planning to do anything as far as television, advertising, media, other media too, to encourage, especially as school is getting ready to start?
Yeah, so we try to push out some messaging every year around, back to school and, just this should be kind of bundled in with everything else families think about as they get ready for school and getting their kids up to date. We are partnering with a lot of local schools and back to school fairs to provide vaccines out in the community. I think that's been one of our strongest efforts is to, go to where the families are, make it easy. And so that's what our team is really focused on. We have we're planning for, and this initiative will be coming to you guys, to the commission soon, is to do some promoting around annual flu vaccination and COVID vaccination. So doing more of a media campaign around that. We also did a focused measles social media campaign as well for measles vaccination. So we are trying to pulse out these messages whenever the opportunity arises as much as we can.
Good. All right. Thank you.
Thank you. Anyone else? Commissioner Killeen?
Thank you, Madam Chair. So this is not a part of the CBGC, the
CPBC.
comprehensive annual. This is a separate allocation from that.
Yeah, so there's a CPBC agreement, which is a comprehensive agreement that you all are very familiar with, and those amendments come before you. I think maybe last year or perhaps the year before, in terms of the fiscal year, the state kind of bundled all of the emerging COVID-like type grants into a separate agreement, and that's called this Emerging Threats Local Health Department, ETLHD grant agreement. You may remember these COVID fundings would come to you one at a time as we were rapid fire kind of releasing them. And they've kind of bundled it all. So it's in this kind of adjacent agreement, I would say, to CPBC. So it's delivered in the same way. It's an annual agreement. We get amendments throughout the year. Right now, the only additional project under this, because the COVID funding has sunsetted and winded down. So the only additional grant under this agreement right now is for COVID immunizations. And so there's not many projects bundled in this agreement, but it operates in a very similar way.
Yeah, because I was noting that in previous years, we had gotten more under this category, but I assume that's the COVID funding. $1,300,000 doesn't seem like much in terms of what we're able to do. And so when it comes to emerging threats, do you have a little list that you're working on of emerging threats above and beyond measles?
So this is, as you know, a changing landscape, right? So we had H5N1, which is bird flu, that we've been closely monitoring.
Are we watching the bird flu?
Yeah, we continue to monitor it. You know, it's obviously continuing to spread amongst animal populations, and it's an ongoing concern, and we are closely monitoring the situation to, what we worry about is the spread to humans. And so that continues to be a threat. There's ongoing measles outbreaks that continue to be a threat. And then just our, general fluctuations that we see every year. So, for example, there could be a COVID-19 virus variant this upcoming year that it proves to be a little bit more serious than our prior years. And so these things are always in flux. I think what we've worked a lot with, with COVID, obviously there was additional influx of resources and funding and expanded staff. And so as that has sunsetted and dwindle down, we are trying to really integrate a lot of that capacity building within our existing core teams, and be able to flex and be able to bring in additional staff internally that we have, and utilize expanded resources and capacity that we've kind of grown from post-pandemic moving forward. And so there are threats that are always around and around the corner that we.
Yeah, but
can even-
we're talking emerging. There's always.
Right.
It's biology.
Yeah.
They're always out there,
Yes.
especially in the days of declining immunizations for all sorts of bugs that are going around. But for now, we're looking at measles, bird flu, and perhaps the new variants of
Yes,
COVID.
I think respiratory virus season that is ahead of us is definitely on our radar.
So I believe nationwide, we're approaching about 1,400 measles cases. And I understand that's a higher number than we've seen in a long time in countrywide. Is that
Yeah.
true?
Yeah, so we have not hit this many cases since 33 years. So the last.
And we're only
large-
halfway through the year.
Yes, and so the last significant year was in 2019, you may remember. There was a pretty large outbreak in a New York community, and we saw some cases here in Michigan as well from that 2019. We've surpassed that number already in 2025, so we are headed in the wrong direction, yes. The measles outbreak, I would say the cases are slowing down nationally, so that's reassuring. There are, though, new cases and new outbreaks every day around the country, depending, it's a highly contagious, if not the most contagious virus that we have. And so if you have a case that, moves around and travels, we will see these sporadic cases, but thankfully the curve of cases is declining. So that's a reassuring sign.
For this year.
In this moment, yes.
Yeah, in
And so,
this
but,
moment.
that could, take off in another direction.
I was going to say, as the epidemiologists look at this, aside from high vaccination rates, 96, whatever percent, this is not going away. It's going to be part of our environment, especially with lower vaccination rates, right? So this is not going away. And then is it a matter of kind of like luck where outbreaks occur?
Not necessarily luck. So I think sporadic cases we are always at risk for, right? We're a global community that is constantly traveling. So, we don't have local community spread, thankfully, but obviously everything is just a flight away of travel away at the moment. And so it's not necessarily, I would say that, you know, the vaccination rates that we have do protect us from these kind of large scale outbreaks. What we worry about is any seeding in a community with lower vaccination rates. And then so we'll see, you know, what we've seen in, there have been, I believe, just 2 outbreaks. I would call them small outbreaks. They were less than 5 cases in Michigan, and they were specifically, you know, kind of contained to that community or family or extended family members that just had lower vaccination rates. And it did not go up.
Right?
There was one in around Traverse City.
Yeah.
And the I'm blanking on the, it starts with the M County.
But anyway.
Yeah, in and around that area.
Yeah.
And it was a very contained out. It didn't go
Yeah.
outside of that community.
But the point I
Mhm.
want to make here, because people talk about international travel and
Yeah.
getting off planes, you
Mhm.
know, and those foreigners in their
Mhm.
disease-ridden countries or whatever that people have in their mind, right? That's where these things come from. But it could be a family goes up to Traverse
Traverse
City
City, exactly.
for July 4th, drives up there, drives back, and
Mhm.
brings it back with them. Is that a reasonable scenario?
Yes, that's
Okay.
a reasonable scenario. And
Thank you. Thank you, Madam Chair.
Yes, thank you. Commissioner Mareki?
Actually, you answered my question because I know there's an outbreak every
Yeah.
year of measles, but I didn't
Yeah.
realize that it's a 30-year high.
Yes, yeah.
So-
So it hasn't been since 33 years where we've had as many cases in a given year, and we are, you know, halfway through 2025. So we'll likely surpass that.
Yeah, so in 2019, you said,
That was the other year where we saw a peak of cases with that was connected to a pretty large outbreak in a community on the East Coast. Mhm.
yeah. I just wasn't sure because there's been so much media
Mhm.
attention to it this time. But I know it happens every year, but it is interesting that this is a higher year. So,
Yes, this is significantly higher than prior years.
yeah,
Mhm.
thank you.
Mhm.
Commissioner Anderson?
Thank you, Madam Chair. I know one thing that hasn't been mentioned, and I just wondered if it's being monitored, the number of mosquitoes and it seems to be worse this year, at least at our household, almost or where we're at, than it has been in previous years. And I just wondered if there might be possibles to get something in the media about steps people can take to reduce the amount of mosquitoes that are around beside spraying. Number of years back, probably most people sitting here will remember the county actually did spraying. And I don't think it was ever followed through with since then. But that's one thing that might be beneficial. But has there been any consideration for, is that a big enough problem yet to deal with mosquitoes?
Yeah, so that is a kind of a regular routine issue that we continue to do surveillance for. So around this season, we monitor, we do what are these mosquito pools where we are collecting mosquitoes and testing them for the various kind of transmissible diseases through those vectors. And so we do ongoing surveillance because there's a few that we worry about more than others. And so we do continued surveillance as part of the state system. And then we, the West Nile virus and whatnot are notifiable diseases. So any of those cases that come up in a given year, we are doing a case investigation, follow-up on, and doing mitigation efforts around. And so if we do find this a positive pool, we work with wherever that was found to do some mitigation efforts around that. So that is part of kind of some of our, I would say, bread and butter communicable disease ongoing work we do alongside our environmental health team. We do typically send out like a before the season reminder of all the precautions, because there are, like you said, everyday precautions that we try to push out to the community and residents of just very simple tips to prevent bites, right? That's the first thing. Prevent the bite, and how to do that, and what are the EPA approved repellents, things like that. I believe we did prepare something, but I think it's worthwhile to look through when we last sent a communication out, because I think getting those regular messages out, especially as people are getting together and gathering and over the summertime. Mhm.
If you find something.
And
If you find something that could be passed along,
yes. Mhm.
then
Yeah.
some of us might like to spread it out into
Yeah.
the communities because people this time of year, of course, are outdoors a lot.
Mhm.
And I know some simple steps, making sure there's no water,
Mhm.
pools
Yes,
of water
dumping the
sitting
water,
around.
yeah.
And also about the cutting their grass
Mhm.
shorter than my wife would like it to be cut.
Yeah. Yeah.
But anyway,
We can do
I
that.
need some backup on it. Let's keep the grass a little shorter. Thank you.
Sure.
Thank you. Commissioner McCormick, did you? Okay. All right. Oh, Commissioner Khalid.
Yeah, thanks for recognizing me a second time, Madam Chair. And Commissioner Anderson, remind me, I'm a big outdoors guy. Um, Lyme disease and ticks.
Mhm.
Ticks are on an enormous upswing in Michigan. I've spent a lot of time out in the woods. 20 years ago, didn't even care about ticks. Never even dawned on you that you spray all your clothes with permethrin when you go out and all that kind of stuff. And in my reading, I see that increasingly in urban areas, ticks are emerging. So I imagine the state does most of this kind of work. Do we look at that at all?
We do look at our cases, yeah, every year, and we've seen increases in our Lyme disease cases, much like
Which
we're
is
seeing.
nasty, by the way.
Yeah.
Lyme disease is
Mhm.
nasty.
Mhm. And so it's, the state is seeing it, and we're seeing this in other pockets across the country. And so
Yeah.
we just do anticipate over the years, like what we call vector-borne diseases, so the mosquito transmitted
Yeah.
diseases, Lyme disease, whatnot. We do anticipate with the changes in the environment that are happening year to year, we will be seeing more cases. So we do follow up on those cases and do our public health work around
Do you have
them.
anything through the state or, for public awareness? Because it's absolutely tied to warmer temperatures that we have been increasingly seeing. Ticks aren't the only biological organism that's been moving north that we have not seen in Michigan before, but it used to be seen in Virginia, and that includes some animals too. So do you have some of that kind of information or just more tick awareness stuff, even if it's the state of Michigan? Because it was just reported the other day, another new tick has showed up in Michigan
Mhm.
that hadn't been seen here before. And I'm not sure what it's a vector for or what it could bring. But they're bloodsuckers, and so
Yeah.
they could be dropping stuff on us. Anything that can be shared at all, even if it's the state, because I imagine the states publish stuff on this.
Yeah, we can pull together some resources that we can share, and some of it is overlapping with the mosquito kind of
Yeah.
education and promotion.
And if
So
it kind of goes with that,
Yes.
and if there's some of the same tips for like
Yeah.
around your house or,
Yeah.
if you have a lot of bushes or, uh, because that definitely is an emerging threat. So, all righty. Thank you. Thank you, Madam Chair.
Okay, thank you so much, Doctor. If there's no other, may I have a motion?
Move approval, Madam Chair.
Moved by Commissioner Khalid, second by Commissioner Anderson. All in favor?
Aye.
Any opposes? Hearing none, motion carried. Madam Clerk?
Moving back to the agenda, F, such other matters as may be properly submitted before the committee.
Well, I know that Commissioner McCormick had asked that someone be here from was it Vista Maria. So could Vista Maria come up and give us a report on what's going on in Vista Maria? Good afternoon. Your name, please?
Name is Meredith Reese,
Meredith Reese, thank you.
Chief Operating Officer, Mr. Maria.
Okay.
Is that better?
Oh, yes.
Okay. All right.
All right, thank you for being here.
Yes. All right. So, again, thank you for allowing me to come this afternoon. And I understand that there were maybe questions, definitely no concerns from the last meeting. So, just to begin, Vista Maria, we are definitely committed ensuring youth and staff safety. That's number one. So that hasn't wavered any. I know that from the media coverage and so forth, actually, portray something much different that was very concerning for us. Many of those allegations and so forth, we had a partner and continue to partner with the Department of Health and Human Services to ensure that we are on the right track in providing the safety care for our youth and our staff. And also, just to let you know that we do have a comprehensive plan that's in place because we took everything seriously. Those allegations and so forth that have been investigated and found to be unsubstantiated, we still continued on with our plans with our staff to ensure that, number one, that our staff and leadership training plan has been underway. We took it seriously in relation to taking a deeper dive through all of our policies and procedures and training for all of our staff. That includes the interracial staff that provides the supervision for our youth and those in leadership positions. That was a dedicated focus for the entire month of June and throughout this month of July. We also took and already had a building or repair renovation plan. With the youth in care and so forth, a lot of times they took their anger and so forth out on our buildings. And we had a small but mighty crew of our facilities team and those who we contract with in order to repair the buildings, but it was very extensive. And so we've had a plan in place where we had actually had all those repairs pretty much in place. We spent, close to almost $500,000 in repairs for all of our 4 buildings that had residents in them. And then we have our plans to actually move from that particular training, but the application of that training piece with all of our staff and dedication there. And then enhance and even strengthening some of our programming components. You may be aware that youth who do come in our care have very acute mental health and trauma needs. And so we definitely examine ourselves as far as how does our program really meet the needs of our kids. And so we added key components that added aggression replacement therapy, dialectical behavioral therapy, and then we expanded the number of our therapists who are trained in eye movement desensitization reprocessing. So some of those key clinical aspects for the treatment and care for our youth that we've added. Not only just some of the other program structure that we found to be beneficial, best practices for our youth. So we're looking forward in partnership with DHS as far as our ongoing communications. I have weekly phone calls with DHS leadership and expressing and demonstrating our progress. What we're doing now and what we do to move forward. So again, I wanted to have the opportunity to share some of those aspects with you all today, and then, of course, to answer any questions that you may have this afternoon.
Does anyone have any questions?
Thank you, Madam Chair.
Yes, Commissioner McCormick.
And thank you for coming today, Ms. Reese.
Yeah.
The question I had was more your interaction, or I guess you combined Vista Maria with Insight, right?
Yes.
And the relationship there and what you're doing versus what they're doing. How is that working, I guess? Oh, yes. Well, it's working quite well because part of our strategic business plan is to expand our community-based services. And Insight Youth and Family Connections definitely focuses on the larger community at whole. We do at Vista Maria on our main campus, we do have community programs on our campus, so to speak, of those young adults, 18 and older, who live in an independent living setting. And then we have foster care. So we have a number of foster homes in the community. But we also wanted to have an additional an extension of that, of our impact and footprint in the community. And INSEC has always been a part of Vista Maria. And so to expand that, what we can do there, that's the reason why for that merge.
I see. Okay. Yes, because we were going over the contract for Vista, well, for Vista Maria and Insight. And we just wanted to put a face to your name. And also, I think Commissioner Anderson had a question about the incident as well. So we just wanted some details on the progression of where you're going and
Yes.
how you're working on those issues. So, yeah.
Yes. Thank you so much. Yes.
So I'll let Commissioner Anderson.
Yes, of course.
Oh, I'm sorry.
I, one last thing on my part was to be whether or not, I'm not sure if it was one of those unsubstantiated claims in media coverage. There was a young lady that walked off the campus apparently, and I don't know if that was true or not, but has there been steps taken to prevent that from happening in the future?
Oh, yes. So, in relation to our policy procedure, for, any youth that are in our care, our campus is set up where we have our perimeter fencing and so forth to prevent those who are not approved to come to our campus, right? So we have our security personnel at the front and so forth. Our kids in care and our families and so forth who are there on our campus, those are our approved visitors. So when a youth are in our care, we do everything we can to prevent that young person from leaving. That's part of our verbal de-escalation techniques that are approved. So we follow our policy and procedures in relation to that. And so when a young person decides that for whatever reason responding to it can be from a bad phone call or something, not going her way, and she decides that she wants to leave, then our staff have to accompany and follow. And then we follow the necessary steps. That means calling law enforcement. That means calling parent and guardians. That means calling the Department of Health and Human Services and those sort of things. So yes, those policies and procedures are in place. And then also part of that in relation to our one of our new processes, that upon the return of the youth, definitely to our campus, that I personally have a debrief with the youth in order to determine what other steps, what could we have done better, what are some things we could do to get her voice to the table. So there's something in addition that we're doing to ensure that all of our kids actually have a voice. Sometimes they might not understand something, and so they just need more information. But if you understand, if you're upset in that moment, it might be hard to hear what's going on. So yes, to answer your question, yes, we have definitely strengthened our policy procedures related to that.
Thank you very much.
Yeah.
Thank you.
Commissioner Killeen?
Thank you, Madam Chair. And your name one more time, ma'am?
It's Meredith Reese.
Reese?
Reese, like in the peanut butter cup.
Yeah, okay. Well, thank you for coming, Ms. Reese.
Yes.
Very much. You mentioned MDDHS.
Mhm.
Where does your funding come from to operate Vista Maria?
Yes, that is from the state of Michigan. We have a per diem rate for each of our programs or contracts that we have.
And then you're part of the Wayne County system also, right, through one of our CMOs?
Right.
Yeah.
Exactly. Yes.
But
And then we do, of course, necessary fundraising and so forth as needed.
yeah, then the fundraising, yeah, but the bulk of the overall, 80% of your money comes from state of Michigan?
Yes, for our programs for our residential treatment.
Yeah, and they're responsible
Care.
for the oversight.
Yes.
How do young people get assigned to you, or how do they wind up at your facility?
Oh, yes, yes. So the department makes a direct referral to our programs. Each of our programs have a particular admissions criteria or grid.
So when you say department, again, we're talking the state of
sorry.
Michigan.
Yes,
Okay,
sorry.
a lot of departments out
So,
there.
yes, understood.
Yeah,
And so we do have a mission criteria or a missions grid, so to speak, that indicates here a child who may present these particular symptoms and so forth or behaviors may be best suited for this particular program. And so the Department of Health and Human Services makes that recommendation based on the child whom they are engaging with and see this would possibly could be a best match. Then we have a certain time frame that we are to assess and to determine if it really is or not. And then from there, upon that agreement, then we were able to admit the youth, and that's at that particular point in time. And that is through a court order that's needed and so forth to be placed with us.
okay. Just for a soapbox for a minute, Madam Chair. Mental health beds are at a premium in this state. We do not have enough. And that's another responsibility of the state of Michigan. I believe it was today's Free Press that had a very lengthy, go to page 9A for another, on our foster care system in Michigan, which is struggling mightily. To me, it's a question of resources here. We have had our own issues with our youth in this county. Things pop up from time to time, right? And even like, I mean, people die in jails, right? But when one happens in our county, everybody gets all upset for a while, and then it all kinds of goes away until 5 years later where there's another incident. And, oh, we got to do something about the. So to me, Ms. Reese, the question of funding and having elected bodies take these issues seriously and allocate, and governors and the people that they appoint to oversee these departments need to, in my mind, need to make a bigger commitment to a couple of things. One is the funding, but also the oversight so that things don't get too far down the road, right? And I get the feeling a lot, because I've been around this stuff a lot for about 20 years, that sometimes the interactions with the state and people file reports, they go up to Lansing, somebody stamps it and says, yeah, we got it, and it kind of goes away. It gets filed somewhere, and there's not like a real active back and forth on those reports and what they're telling the state, that it's to some extent pushing paperwork when we have real lives that are involved in all of this. So I certainly wish you the best of luck out there and your stewardship. These kids need better than they have gotten for a lot of reasons. But I do think state of Michigan definitely has to step up on some of these programs and not leave them so underfunded. And that's where a lot of the problems come. It's just, I encourage people to read the foster care thing today in the paper. It's horrendous, right? What we're putting these kids through. And then, what happens when there's no foster parents out there. That's been declining for years and years, the number of people that are willing to foster a child. I think I heard out at the Ennis Center about a decade ago that it used to be something like 13 homes or parents that applied for every one child in foster care. And now the number is something like 140 or something really outrageous, that there's just people not willing to take foster care anymore. And again, it's young people's lives, and we need to do much better. So thank you for being here. Thank you, Madam Chair, for the time.
Thank you, Tim. Commissioner Morecki?
Thank you, Madam Chair. I just have a follow-up from Commissioner Anderson's. So when this incident happened, were those protocols in place? Did someone follow?
Yes,
Oh, so the newspaper made this,
right. That has always been our protocol for our staff to follow our youth. Yes,
Okay.
exactly.
okay. So this was kind of,
Yes, so when it comes to in the community, I think some community members might think that we're able to physically prevent the youth, right, to go any further. We cannot. We could only follow and verbally de-escalate to a certain extent.
okay.
And sorry.
I did not read the articles, but it sounds like it was probably not the incident, but much ado
Right.
about anything from the paper standpoint. You already had
Right.
all those protocols in place.
Yes, we did.
And they were followed.
Yes.
Okay, thank you.
Mhm.
Thank you, Madam Chair.
Thank you. All right, Ms. Reese, thank you so much for being here.
Right. Yes, thank
We
you.
Appreciate it.
Thank you. Mhm.
Madam Clerk?
G, public comments.
Are there anyone on the phone or on the line or?
There's no one on Zoom indicating that they would like to speak and no emails were received.
No one.
No.
All right, thank you. Is there anyone in the audience that'd like to speak? Anyone in the audience? Feel free to come up and speak. All right. Thank you so much. Next item.
Adjournment.
It's been moved and supported. We are now adjourned.